22 million adults in the U.S. live with asthma, and the peak of asthma season now here as we move through the months of fall. Joining us for more on how to stay protected is asthma and allergy specialist Dr. Justin Greiwe. Dr. Greiwe, why are the fall months considered that peak asthma season and just a dangerous time for those suffering from asthma?
We consider August through December to be a critical time of year for patients who live with asthma, just due to that heightened exposure to seasonal asthma triggers and increased risks for exacerbations during that time frame. That third week of September specifically is what we call asthma peak week, and that's when emergency room visits and hospitalizations for asthma tend to be the highest in the year. So each fall, the Asthma and Allergy Foundation of America publishes its annual Asthma Capitals Report, and this report ranks the 100 largest U.S. metro areas by how challenging they are to live if you have asthma. So I encourage your audience members to take a look at that and see where their city ranks. But it's important to understand, if you have asthma, what your triggers are and trying to avoid those as much as possible this fall. The classic fall triggers would include pollens like ragweed, mold, but also weather shifts and barometric pressure changes, viral triggers, bacteria, pollution. All these things can trigger patients during the fall season.
Dr. Greiwe, are there symptoms people with asthma should be looking for?
Yeah, common symptoms with asthma often include shortness of breath, chest tightness, wheezing, and cough. And these symptoms occur when the airways become inflamed and when they become tight. It's important to understand that underlying inflammation is really what puts patients at risk for those flare-ups. Asthma is a chronic disease, which leads to nearly 9 million asthma attacks and over 700,000 ER visits due to flares. So it's not something to take lightly, and it's important that we work with our asthmatic colleagues and patients to really make sure that they're being well protected this fall. Not just the fall allergens, the ragweed and the mold, but also back to school with viruses, kids bringing those home and can trigger asthma. And the idea is to really be proactive for being preventive about their asthma care. So we encourage audience members with asthma to talk to their doctors now, so review treatment plans and know what to do before things get worse this fall. So you can really reduce your risk for an asthma attack.
Hospitalizations from asthma tend to spike in the fall. Dr. Greiwe, what causes that spike?
Sometimes patients in the summer months tend to be maybe a little more lax in their maybe asthma treatment plan, so they might not be taking their daily inhalers as often as they should, leaving them at risk for a flare-up. But all these things can contribute: the weather changes, the barometric pressure shifts, the pollens, the viruses. And it's important to know that it's not just triggers that are important to understand, but also understand how to appropriately treat these flare-ups when they do occur. So a lot of patients with asthma will have a rescue inhaler, and traditionally rescue inhalers just reflected or attacked that tightening of the airway. They didn't treat the underlying inflammation, but just relieved the tightening. And so over time, if you're just relying on a traditional rescue inhaler, that can leave someone vulnerable to future attacks because we're not addressing that root problem of inflammation. So when we look at new recommendations from global asthma experts, they're really calling for more of an anti-inflammatory rescue approach, which means we're using a rescue inhaler to address both the tightening and the inflammation, which helps calm down the airways and allows less frequent hospitalizations and less frequent attacks. So if your audience wants to dig deeper, there's some great sites. One of them is modernageofrescue.com that has great information on anti-inflammatory rescue strategies. And other organizations like the AAFA that I mentioned earlier has great educational resources and are supporting research to improve asthma care for everyone. And ultimately, our goal for the fall season is to allow people to be healthy and happy this fall and avoid those trips to the ER.
We're joined right now by asthma and allergy specialist Dr. Justin Greiwe, discussing the peak of asthma during the fall months. Dr. Greiwe, what proactive steps can someone with asthma tend to take to reduce that risk of an attack?
Making sure that you're really staying up to date and active with your primary care doctor and or specialist. Others will rely on specific specialists like board-certified allergy immunologists like myself or board-certified pulmonologists. All those doctors can help create a treatment plan and give you or your asthma patients a plan in place and ways to address asthma should it get worse this fall. It's really about being proactive and understanding the risks, understanding the treatment paradigms, and being prepared for when those triggers occur. All those things can be really helpful for patients as they get into the fall season.
There are many recommendations for an anti-inflammatory rescue approach in fighting asthma. Doctor, what are some of those benefits?
We used to just treat the tightening of the airways, but now that we have learned more about what triggers asthma, it's really addressing the inflammation that's the most important. when we talk about treating an asthma flare, we want to bring in an anti-inflammatory rescue approach. If you're unsure what that means, or if you want to talk to your doctor, we'd really recommend you going to your primary care doc or specialist and really asking about what I can do to prevent flare-ups by using an anti-inflammatory rescue. Sites like modernageofrescue.com have great information about what that means.
And Dr. Greiwe, any other places people can check for more information about fighting asthma season, this peak season of fall?
Organizations like the AAFA offer great resources. Also, the American College of Allergy and Immunology or the American Academy of Allergy and Asthma and Immunology are all great resources. All those things can be found online and provide kind of medically backed, science-based research on asthma treatment and care.
Dr. Greiwe, thank you for joining us. That's Dr. Justin Greiwe, an asthma and allergy specialist, talking about lowering the risk of asthma during the fall months. To listen to this interview again and many others, you can head to podcast at krvn.com. I'm Paul Perkins on the Rural Radio Network.